Hello viewers, welcome to another segment of Live Expert Interviews.tv. My name is Steve Young and thank you so much for joining us today. Today we're talking about a very important topic, and that topic is how to find a good optometrist. Now fortunately, joining us from Austin, Texas is Dr. Denise Smith. Doc, thanks so much for joining us today.
Thank you for inviting me to be on today, Steve. I'm really glad to be here.
Well, thanks for joining us. So, Doc, really the burning question everybody has right now is, with all your years of experience, what advice would you give to somebody looking for a good optometrist? Maybe even the top three things.
Well, if we're looking for the top three things, I would probably say experience, expertise, and excellence. So just remember the three E's. First of all, being experience. We get experience from being down in the trenches. It takes practice to be good at anything, and being a doctor is no different. That's why it's called practicing optometry. Not all vision conditions are going to present the same way, so patients are really great at teaching doctors a lot of things. So the more experience the doctor has, the more tools he'll have in his toolbox to be able to provide solutions. So I really think experience is an invaluable tool because it teaches us a lot of things that we can't learn in the classroom. Secondly, I mentioned expertise. And what I mean by this is you want to find someone who provides the services you're actually looking for, because not all optometrists do the same things. Some optometrists provide family eye care, while others concentrate on treating eye diseases or fitting specialty contact lenses, and then there are those who specialize in pediatrics or neurooptometry. So whatever you're looking for, you want to make sure that the optometrist is going to be able to meet your specific needs. And again, that could be updating your look with a trendy new frame, or getting new contact lenses, treating your dry eyes, or getting your child the skills they need to succeed academically. Optometrists can help with all of those things, but not all optometrists do all of those things. So you want to make sure you actually know what you're getting before you go in. And then thirdly, I would say excellence. And by this I mean you want to find an optometrist who has an excellent reputation out in the community as well as with their colleagues. Because two doctors can provide the same type of service, but it doesn't going to mean you're going to get the same quality of care. And I wouldn't get too hung up in all the titles or how many initials the doctor has behind their name. Those things are great, but they don't always guarantee good service. So, there's that old saying, you can't please all the people all the time. But if the doctor is consistently doing what's in the best interest of the patient, it usually shows.
Wow, Doc, that is some excellent advice. I love that. And I know the last one that you're talking about is, checking their reputation. You can go online and you can look in Google and Yelp in some different areas, and you can look for the reviews that people are leaving. And that's a really first indication of whether or not this doctor is a good doctor. Wouldn't you agree?
That's going to play a big part in it, yes.
Yeah, and I know that you mentioned to me that obviously you want to go and you want to meet the doctor and you want to do a more thorough, meeting and making sure that they're the right doctor for you.
Oh, absolutely.
All right. Well, Doc, hey, look, if someone was looking for an optometrist and they came to your office, what type of an experience could they expect?
Well, coming into my office, another three words come to mind, and those would be comprehensive, personalized, and genuine. What I mean by comprehensive is that I look at my patients as more than a set of eyeballs. They're people, so I'm looking at how vision affects the person as a whole and how it's being integrated with the other sensory systems, because it goes beyond just seeing 20/20 and needing eyeglasses. Secondly is personalized, and the best way that I can sum this up is we follow the golden rule. So do unto others as you would have them do unto you. And actually, I take this a step further. So when I have a patient sitting in my exam chair, I think to myself, if that were my mom or my husband or my nephew or my grandmother, how would I want the doctor to treat them? And then that's what I do, because that's what they deserve. Every treatment program is individualized and tailored to that person's specific needs. Here in my office, there is no one size fits all. I like to know who my patients are. I like to know what they do. I like to know what they want to be able to do, because that's going to help me better serve their needs. From the moment that they call in for that first appointment, throughout the evaluation process, and then also the treatment programs we offer, we want the patient to know that they found the right place. And if for some reason they need a service that we don't provide, then we help them find the right place. And I'll refer them to a colleague that I trust that can give them what they're going to need. And then thirdly would be genuine. And this one's pretty simple. What you see is what you get. There are no facades. We're not trying to sell anyone anything. We're just here to help people. Whether it's a child who is struggling with reading, or maybe it's a parent who doesn't want their child to have eye muscle surgery, or an adult whose life has been changed by a traumatic brain injury. Because at the end of the day, it's not about me. It's about the value that I can bring to them to make their lives easier, to make their lives better. It's just about doing the right thing. And to me, if you're helping people, then you're doing the right thing.
Wow, Doc, I love the way you personalize each one of the programs, as well as you care. You can obviously tell you care very much about your patients.
Oh, very much so. I take it very personally, and I love all my patients. We really develop that connection, and that's why I do what I do.
I can definitely tell. Well, let me ask you, Doc, because of your years' experience and all the, your practice, how is your practice different from maybe some of the other doctors of optometry in the local marketplace?
That's a great question. Remember I said that not all optometrists do the same thing. My expertise is in vision therapy and visual rehabilitation, and my practice is dedicated to developmental, behavioral, and neuro-optometry. What this means is this is a specialized field of optometry that focuses on ensuring proper vision development in children, addressing visual conditions that can negatively affect learning. We look at strabismus and amblyopia, which is commonly known as lazy eye, and then we also treat visual conditions that result from neurological insult, like a traumatic brain injury. So if you're just looking to get a new contact lens prescription, you wouldn't need to come to me. But if you have a child that's struggling academically, or has been diagnosed with a learning disability, or maybe they're really smart, but it's not reflected in their school performance, and you're just, you can't figure out why, then this would be the right place for you. Similarly, if you have a child who is exhibiting attention deficit type symptoms or having other behavioral issues, vision could be the culprit. And so if any of these things sound familiar to you or about your child, you'd want to rule out vision first, and that requires testing that goes well beyond a school vision screening and even beyond a traditional eye exam. You'd also want to make sure that the other systems supporting vision are functioning well. Over the last 14 years, in addition to completing my vision therapy residency, I've learned about other modalities that support vision. And so we want to ensure that things like the primitive reflexes are integrated, that vision is integrated with the vestibular system for balance and coordination, and then also ensuring that the eyes and the brain are getting the proper nutrients they need to function well. Because again, it goes beyond needing glasses. And if there's one take-home message that I could get out there, it would be that 20/20 is not perfect vision. That's a common misconception that many people have, and most of my patients have 20/20 eyesight, and they don't wear glasses, yet they still have a number of other visual conditions that are affecting their quality of life. So you want to make sure that you're familiar with all of those concepts, and if you're not, I would encourage you to visit my website. There's a ton of information on there, or feel free to call my office, and we're happy to send some information out to you.
Wow, Doc, there's a lot of stuff that you just shared with us.
I know.
We really appreciate that. Just out of curiosity, how did you start working with kids? I mean, that seems like a niche that you focused on. How did you end up doing that? What got you into that niche part of the business?
Well, you know, I've always loved working with children, and I basically paid my way through undergraduate college by being a nanny. So when I entered into my doctorate program, I was looking for a way to integrate optometry and my love of working with children, and this has just turned out to be the perfect fit for that.
I love it. Now, Doc, I know you mentioned to me that you do some special things for new patients. What exactly is it you do for new patients?
Well, we invite all new patients to visit our website and complete the vision questionnaire to determine if they would benefit from the scope of services we provide. After completing the questionnaire, we offer a complimentary consultation to review the results from the questionnaire so we can get a good idea of what may be going on. In addition to that, though, for those of you who are watching the video, we want to offer a special promotion, and that is a complimentary visual skills assessment. And this evaluation would normally cost $300, but as a thank you for taking the time to watch the interview, we'd like to offer it free of charge. So for anyone who's interested in that, when you call into the office, you want to make sure you mention that you watched the Interview the Expert video, and my staff will be happy to get that set up for you.
Wow, Doc, that is really very nice of you, and I'm sure the viewers will appreciate that.
I hope so.
Well, all right, so there you have it, viewers. If you're looking for a good optometrist, take the Doc's advice, go online, use the information that she provided to you today. Now, Doc, your website is, I know it's on the screen, but go ahead and give it to us.
It is www.cvdaustin.com.
Great, and the number's on the screen right there, but give it to us again.
And our phone number is 512-329-8900.
Perfect. Doc, I want to thank you so much for joining us today and sharing your awesome advice. We really appreciate you being here.
You are so very welcome. And if this video can help one person get what they need, then I'm happy about it.
There you have it, viewers. If you're in the neighborhood, if you're anywhere near Austin, Texas, and you're looking for an optometrist, make sure you look up Dr. Denise Smith for all of your optometry needs. Viewers, we'll see you on the next segment of LiveExpertInterviews.tv.